everyone, this is Dr. Mary joining you from the Health Centre in Yekooche First Nation. So today is January 19th, 2021. It's an exciting day. We're supposed to be getting a shipment of the Moderna vaccine coming up with Amanda. So I've been chatting with Angie and with Christine, and I know there's been some questions about the Moderna vaccine, about its safety, about how well it works. And so I wanted to take the chance to give you some more information about the vaccine, as well as to hopefully answer some of the questions that have come up. So the Moderna vaccine was approved on December 23rd, 2020. It's an mRNA vaccine, so essentially it teaches our bodies to make a copy of the spike protein found on the COVID virus, and so that our immune systems are able to recognize and respond to the virus. So you cannot get COVID from getting the vaccine. It will not make you sick, but it will teach your immune system how to fight COVID if you are to get the virus. There's been some questions about, how do we know that this vaccine will work? So I wanted to share some of the data that they have from the research that was done on this vaccine. So it was studied in the United States in a population of 30,000 people. So 15,000 people received the vaccine and 15,000 people received a placebo or no vaccine. In the 15,000 people who received the vaccine, there were only 11 cases of people who got COVID. In the 15,000 people who did not receive the vaccine, there were 185 people who got COVID, including 30 severe cases and one person who died. So based on this research, they found that the Moderna vaccine is 92% effective in preventing people from getting COVID, and as you can see from the numbers, entirely prevented serious or life-threatening cases of COVID, which is phenomenal. There's been some questions about the potential side effects of the vaccine. So the most common side effects from the vaccine are pain at the site of the injection where the needle goes in, so some muscle pain, maybe some irritation of the skin. Some people have found that they get chills or fatigue for a few days after the vaccine, but it's less than about 1 in 10 people who notice those kinds of side effects. There's also the very, very unlikely possibility that you could have an allergic reaction to the vaccine. This is why we ask you to stay for 15 to 30 minutes after getting the vaccine to make sure that you don't have a reaction. If you do, we do have the tools at the clinic to respond to that, but again, it's extremely unlikely. As with anything in healthcare and in medicine, the treatments that we offer, there are risks and benefits. In this case, for the majority of people in Yekooche, I do think that the benefits of the vaccine, of preventing you from getting COVID, are much, much greater than the minor or very unlikely more severe side effects that you can get from the vaccine. But if you do have any concerns about it and about you in particular and your healthcare, please come talk to me. I'm happy to chat with you. You can also reach out to Dr. Todd or Dr. John over telehealth to talk more. It is recommended in people who have health conditions, problems with their heart, problem with their lungs, especially because you are more at risk to have serious illness from COVID. We're really recommending people who have health conditions to get the vaccine, and it's been shown to be safe in people who have health conditions. The First Nations Health Authority has approved and is encouraging First Nations people to get the vaccine. They're recommending a whole community approach, which means that everybody over the age of 18 gets the vaccine. And what this leads to is if we have more than 7 out of 10 people in a community getting the vaccine, we are able to get something called herd immunity, which essentially means that everybody, even those who haven't been vaccinated, get protected. So again, I want to just emphasize that this is not mandatory, getting a vaccine. It's your choice, but I did want to make sure that you had all of the information available to you. If you have any questions, I'm going to be in clinic all day along with Amanda. Please don't hesitate to come by and say hi, ask us any questions that you have. And I think this is a great opportunity to protect the people of Yekooche, especially our elders. So take care of yourselves. This is an exciting day. This is the beginning of the end of what's been, you know, a really long and difficult process, living through a pandemic. So please take this information, share this video, and come by the health clinic if you have any questions for us. Okay, hope to see you soon. Bye.